Vitamin D deficiency, feeling tired all the time. Vitamin D deficiency, feeling tired all the time. Aching muscles. You might be missing the sunshine vitamin. Let's uncover the hidden signs of vitamin D deficiency and how to fix it. According to UK and USA health specialists, vitamin D deficiency is a silent yet widespread problem affecting millions. Known as the sunshine vitamin, it impacts bones, muscles, immunity, and energy levels. At WA Health and Care, we'll explain the causes, symptoms, and practical ways to prevent this deficiency in daily life. What is vitamin D deficiency? According to many endocrinologists and nutrition specialists, vitamin D deficiency is now considered one of the most common yet most overlooked health issues in the UK and USA. Simply put, vitamin D deficiency means your body is not getting enough vitamin D to support essential functions like maintaining strong bones, regulating mood, boosting immunity, and keeping your muscles active and healthy. In countries like the United Kingdom and the United States, this problem is increasing rapidly because people spend most of their time indoors, sunlight exposure is limited, especially during winter, and dietary intake is usually not enough to maintain healthy vitamin D levels. Many doctors in the UK describe vitamin D as the sunshine vitamin, and when sunlight is low, deficiency becomes almost unavoidable without proper supplements or dietary support. Common signs include fatigue, low mood, muscle aches, joint pain, frequent colds, hair thinning, and overall low energy. The tricky part is that these symptoms often feel normal, so people don't realize they're actually experiencing a genuine medical deficiency. That's why specialists recommend getting your vitamin D levels checked through a simple blood test if you notice ongoing tiredness or body pain without a clear reason. At WA Health and Care, we highlight these topics because early awareness can prevent long-term problems like weak immunity, bone issues, and chronic fatigue. Understanding vitamin D deficiency isn't just medical knowledge, it's a daily lifestyle reminder for anyone living in the UK or USA to prioritize sunlight, nutrition, and regular health checks. What are symptoms of vitamin D deficiency? According to many endocrinologists and general health specialists, the symptoms of vitamin D deficiency can be surprisingly subtle, which is why millions of people in the UK and USA experience them without realizing the actual cause. The most common symptom is persistent fatigue, a level of tiredness that doesn't improve with rest. Many patients report feeling drained throughout the day, even after a good night's sleep. Another key symptom is muscle and bone pain. Specialists explain that vitamin D plays a major role in calcium absorption, so when levels drop, your bones and joints start to feel weak, stiff, or achy. People often describe this as a deep body pain, especially in the lower back, hips, and legs. Low vitamin D can also trigger mood changes, including mild depression, low motivation, irritability, or what doctors call seasonal low mood, which becomes more noticeable during winter in the UK and northern parts of the USA. A weakened immune system is another major sign. Individuals with deficiency tend to catch colds, flu, or infections more frequently because their body's defense system becomes compromised. Some people also experience hair thinning, slow wound healing, headaches, and even trouble sleeping. In children, symptoms may include delayed growth and bone weakness, while adults may experience increased risk of fractures. At WA Health and Care, we highlight these symptoms because early recognition is essential. If you consistently feel these signs without any clear reason, healthcare specialists strongly recommend a simple vitamin D blood test to prevent long-term complications. What are causes of vitamin D deficiency? According to many endocrinologists, nutrition experts, and primary care physicians, the causes of vitamin D deficiency in the UK and USA are strongly linked to lifestyle, climate, and daily routines. The most common cause is insufficient sunlight exposure. Vitamin D is known as the sunshine vitamin because your skin produces it when exposed to sunlight. However, long working hours indoors, colder climates, and limited daylight, especially in the UK and the northern states of the USA, restrict natural vitamin D production. Another major cause is skin pigmentation. Doctors explain that people with darker skin require more sunlight to make the same amount of vitamin D as those with lighter skin. This makes deficiency more common in South Asian, African, and Middle Eastern communities living in the UK and USA. Diet also plays a significant role. Vitamin D-rich foods like salmon, eggs, fortified cereals, and dairy products are not consumed regularly by many households, leading to low intake. In addition, people who follow vegan or vegetarian diets may struggle even more, as many natural vitamin D sources come from animal products. Medical conditions such as obesity, kidney problems, liver disorders, or malabsorption issues can also reduce the body's ability to use vitamin D effectively. Some medications, like steroids, weight loss drugs, and certain anticonvulsants, can interfere with vitamin D metabolism as well. At WA Health and Care, we emphasize these causes because understanding them helps audiences in the UK and USA identify their personal risk factors and take early action, through sunlight, diet, lifestyle changes, or medical guidance. What are preventions and precautions for vitamin D deficiency? Healthcare specialists across the UK and USA, including endocrinologists and nutrition experts, consistently highlight that preventing vitamin D deficiency requires small but consistent lifestyle adjustments. The most effective prevention is regular sunlight exposure. Doctors recommend spending at least 10 to 20 minutes in natural sunlight, especially during midday, whenever the weather allows. This is particularly important in the UK, where sunlight is limited for most of the year, and in northern regions of the USA where winters are colder and darker. Diet is another powerful precaution. Including vitamin D-rich foods, such as fatty fish, salmon, mackerel, fortified milk, eggs, mushrooms, and fortified cereals, helps maintain healthy levels. For those following vegetarian or vegan diets, fortified plant-based milks and supplements become even more important. Specialist dietitians emphasize consistency. Small doses daily are more effective than large amounts occasionally. Healthcare professionals also advise considering vitamin D supplements, especially during winter months. In fact, many UK doctors recommend a daily vitamin D supplement from October to March due to low sunlight. In the USA, supplements are commonly suggested for individuals with indoor jobs, darker skin tones, or chronic fatigue. Always choose doctor-approved dosages to avoid unnecessary excess. Other precautions include maintaining a healthy weight, staying active, managing medical conditions that affect absorption, and scheduling regular blood tests if you experience ongoing fatigue, body pain, or low immunity. At WA Health and Care, we highlight these preventions because early action helps you stay energetic, strengthens immunity, and protects long-term bone and muscle health, especially for audiences living in the UK and USA. What are foods rich in vitamin D? According to many nutrition specialists, dietitians, and general health consultants across the UK and USA, adding vitamin D-rich foods to your daily routine is one of the most reliable ways to maintain healthy levels, especially in countries where sunlight is limited for most of the year. The most powerful natural source is fatty fish. Options like salmon, mackerel, sardines, and tuna are packed with high-quality vitamin D. UK and USA nutrition experts often recommend including oily fish at least 1 to 2 times per week to naturally support bone and immune health. Eggs, especially the yolk, are another excellent and widely available source. Having 1 to 2 eggs a day can make a meaningful difference, and they fit easily into breakfast routines across both regions. Fortified foods are especially important in the UK and USA because many brands add vitamin D to everyday items. These include fortified milk, plant-based milks, such as almond, oat, and soy milk, fortified cereals, orange juice, and yogurts. Dietitians often recommend checking the nutrition label to ensure vitamin D is included. Mushrooms, particularly UV-exposed mushrooms, are a valuable plant-based option, They naturally produce vitamin D when exposed to light, similar to human skin. This makes them a great choice for vegetarians and vegans. For people who struggle with regular meals or limited appetites, specialists suggest incorporating vitamin D fortified snacks or consulting a doctor about supplements. At WA Health and Care, we highlight these food options because a balanced diet, combined with sunlight and routine health checks, helps UK and USA audiences maintain stronger bones, better immunity, and stable energy levels throughout the year. What are daily life tips for vitamin D deficiency? Health specialists across the UK and USA, including endocrinologists and lifestyle clinicians, consistently emphasize that managing vitamin D deficiency isn't just about supplements, it's about simple, consistent daily habits. The first tip is to maximize natural sunlight whenever possible. Even 10 to 20 minutes outdoors during midday can significantly support vitamin D production. Whether it's a short walk, sitting near a sunny window, or spending time in your garden, daily exposure helps maintain healthy levels, especially through the darker months in the UK or northern USA. Another daily habit is planning balanced meals. Include vitamin D-rich foods like salmon, eggs, mushrooms, and fortified products in your routine. Small adjustments, such as choosing fortified milk for breakfast or adding mushrooms to dinner, make a noticeable difference over time. Doctors also advise staying physically active, as regular movement improves your body's ability to use vitamin D effectively. Simple exercises like walking, stretching, or indoor workouts can boost metabolism and support bone health. Maintaining a healthy weight is another important tip. Research in both the UK and USA shows that excess body fat can store vitamin D, making it less available for the body to use. Specialists also recommend setting reminders for daily supplements if your doctor has prescribed them, especially during winter, when sunlight is minimal. At WA Health and Care, we encourage these small, practical steps because they help you maintain stronger bones, better immunity, and more stable energy levels, making vitamin D a natural part of your daily routine in both the UK and USA. Vitamin D deficiency may seem subtle, but early awareness can prevent fatigue, weak bones, and low immunity. Specialists in the UK and USA recommend sunlight, diet, supplements, and regular checkups. Stay proactive, follow these tips, and strengthen your health. Brought to you by WA Health and Care.